Trump administration seems to be downplaying the resurgence of COVID-19 in the country, while many health experts are urging the U.S. needs to take action and quickly. For example, over the weekend, Vice President Mike Pence continuing to say that major progress has been made. Let's bring in Natalie Jennings, the editor for The Fix with The Washington Post. Hey there, Natalie.
Hey, Todd.
So what is the administration trying to say here? What do you make of it all?
It's a fair question to ask. The administration has maintained that mask wearing is optional, encouraged but optional. That's coming from the CDC, one of our top health agencies. We've seen model behaviors change over the course of the last few weeks. Most notably, yesterday, Vice President Mike Pence was at a church in Texas and wore a mask himself. But there has been no different official guidance, even as we're seeing more and more members of the administration publicly adopt wearing masks. We, of course, have not seen President Trump do that.
Yeah, so I'm curious about that, too. You know, the way the president is talking about this, and obviously he is very focused on his own re-election coming up in about 4 months now, which adds a whole political dimension to all of this, Natalie.
It does, yes. I think President Trump's very strong concern is about the economy and the perception of a weakened state of America going into his election. And we've seen reporting prior that he says wearing masks appears to make him, look weak. It could be something used against him. This is happening as more and more of his members of his administration are appearing at briefings and that sort of thing, wearing masks. He has held out. His press secretary again today said that he thinks it's a choice and not one that he has to make.
And so the question now becomes, what is the path forward here for all these different states? And I certainly know there's been some criticism, not only from Democratic governors, but even some Republican governors, talking about a vacuum of leadership from Washington, that they're almost left to fend for themselves. Whereas the vice president is saying, we're going to defer to the governors here. We're going to let them take the lead.
Yes, there has been there's a phrase that Vice President Pence, who leads the coronavirus task force, likes to call it a whole of government approach that the United States has taken. But that has really meant in a lot of key ways that this is kicked down to the states, which, of course, don't have the resources of the federal government to coordinate. When things say, New York is sort of on a downward trajectory in terms of its caseload, a strong federal response would mean that you could easily move resources to Texas or Arizona or one of these states that has a bigger burgeoning number of cases. And it's really hard for states to do that without a very strong federal program in place.
Yeah, and does it get kind of confusing, too, for people in the states in terms of mixed messaging? They might hear one thing from top doctors like Dr. Anthony Fauci. They might hear something else from the vice president. President Trump himself is saying something. The Republican governor of their state might be saying something else. Their local county officials might be saying something else entirely as well. How do you sort of figure out, hey, what is and isn't the right way to go here?
It's hard enough, I think, when the scientific consensus has evolved. Early in March, we weren't sure that masks were something that scientists were going to recommend, and they wanted equipment preserved for healthcare. And that's confusing enough to people. And then you get into the mix, people, a governor of a state like Texas now wearing masks when it hadn't been required. A city had tried to require that. President Trump still hasn't weighed in, and we know ultimately a lot of President Trump's followers are going to follow him, and his word on things it tends to be adopted. So it's going to be really hard to get sort of top-down guidance on that when it's not coming from the top.
Yeah, no, such a great point. And I read something else interesting that I wanted to get your take on, that, for some people in certain parts of the country, for example, Texas, they see wearing a mask as being anti-Trump.
Yes, I've heard this. I think it's being compelled to wear a mask is originally a thing that sort of the reason for the pushback on the guidelines. You can voluntarily do this, but why compel it? But it's sort of evolved to, this is a symbol. This is a political symbol more than a health symbol, more than a responsibility symbol. And so, not only are they, maybe they would be inclined to do it, but now they've got to go and answer to other people who feel the same way and explain their decision. And it gets fraught in all sorts of ways that make it more complicated than this is helping quell this disease.
Hey, great to have you on the show with us, Natalie. Thanks for taking a bit of time.
Anytime.
Natalie Jennings with The Fix of the Washington Post.